Hello, this is Mo Chen from School of Education, University of St. Joseph at Macau. I'm very happy to do the presentation today. And the study I'm presenting here is a study conducted by Ms. Jing Jian, myself, and Dr. Sean Go. At the time, I was working at Nanyang Technological University. The study title was Hello from the Other Side of the Screen, COVID-19 and the Use of Tele-practice in Speech Therapy Services in Singapore. I'm going to cover the content as usual, introduction, methods, results, and discussion. Speech therapists, STs, also known as speech language pathologists, SLPs, in the United States. They are a type of allied health professionals who specialized in the assessment and management of speech, language, and other communication problems, including but not limited to speech or articulation disorders, resonance disorders, receptive language disorders, expressive language disorders, cognitive communication difficulties, fluency difficulties, and swallowing disorders. More specifically, some problems include difficulties in properly forming certain word sounds, poor voice quality, difficulties in processing textual or audio language information, and difficulties expressing themselves through speech or writing. These may arise from different causes, like developmental, environmental, or medical conditions, or may be idiopathic with no clear cause. Telehealth, also commonly used interchangeably with telemedicine in the field of telerehabilitation, it is defined as the systematic provision of healthcare services over physically separate environments via information and communication technology, ICT. It encompasses synchronous and asynchronous patient monitoring as well as telepractice, the provision of assessment, intervention, and/or consultation services remotely through the use of telecommunications technologies. On January 23, 2020, the first confirmed case of COVID-19 in Singapore was announced. Thereafter, COVID-19 case numbers increased exponentially, like the worldwide, prompting the enforcement of the strict safety measures island-wide and encouraging a move of many daily activities from schools to workplaces to everyday lifestyle to an online medium. At the height of the pandemic, a circuit breaker period was introduced from 7th April 2020 to 1st June 2020, where all workplaces that were deemed non-essential were closed or completely moved online. To combat the spread of COVID-19, the adoption of video conferencing as a communication tool has increased manifold in industries, both in Singapore and across the world, and healthcare was no exception. The outbreak of COVID-19 transformed the working experiences of many STs, especially in their professional roles, responsibilities, and duties. Unsurprisingly, a significant increase in uptake of telepractice by STs since the start of the pandemic was observed across all clinical activities, especially for treatment, assessments, and examination result reporting. When designing electronic materials for telepractice, game-like features were preferred in order to engage and retain clients' attention, motivate them, as well as to encourage reinforcement of specific communication behaviors through practice. At present, little study has yet been done on the use of telepractice on speech therapy services in Singapore. It is unclear where telepractice stands with speech therapists as a mode of service delivery following its increased focus post-outbreak of COVID-19. This study is an endeavor into how speech therapists are providing services since the COVID-19 outbreak, with a particular emphasis on their use, experiences, attitudes, preferences, and future practice plans on telepractice compared to face-to-face therapy. There are 4 specific research questions. First, how have STs in Singapore been involved in telepractice during the pandemic? Second, what are STs' experiences using telepractice in speech therapy? Third, what are ST's attitudes and preferences towards the use of telepractice in speech therapy? Fourth, what are ST's future practice plans in their delivery of speech therapy services? This was a cross-sectional survey design. The online survey consisted of 2 screening questions, 11 demographic questions, as well as 16 content-related questions, exploring their use, experiences, attitudes, and preferences, and future practice plans on telepractice relative to face-to-face therapy. Data collected was primarily quantitative in nature, with some open-ended questions allowing further qualitative elaboration. Questions were mostly in the form of multiple choice, where questions allowed for more than one option, a multiple selection option was enabled. Questions that inquired about participants' attitudes and preferences also used the 5-point Likert scale. The survey was conducted online with no direct interaction with participants, and the survey link was disseminated remotely in email invitation to 2 tertiary education institutes in Singapore, offering programs in speech therapy, and 19 special education schools where speech therapy-related services were provided in Singapore. A similar survey invitation was also broadcasted on messaging app Telegram via SG Research Longbang, a research advertisement channel popular in Singapore. The survey was open to responses on 4th March 2020 and closed on 15 May 2020. The responses collected were checked for duplicate and missing data. Descriptive analysis was conducted using JASP. For questions that gathered qualitative responses, content analysis was conducted to identify and categorize the data by common key themes, which were then counted accordingly. There was a total of 110 valid responses from 110 participants. Most of them were female and Chinese ethnicity, aged 20 to 30 years. And the sample consisted of 79 practicing STs and 31 students who were studying in speech therapy programs in Singapore. A majority of them worked at the public or private acute settings. About half served clients who were aged 8 to 18 years old. For those practicing STs, about half of them held a master's degree. The practicing STs had about 6.6 years of experience on average. In terms of their involvement in telepractice, since the outbreak of the COVID-19 pandemic, they reported that telepractice was mainly used for intervention, followed by assessment and consultation. Telepractice was mostly commonly used in the clinical areas for autism spectrum disorder, developmental language disorder, and speech sound disorders. Telepractice was least often used in respiratory care, selective mutism, and cleft lip and palate craniofacial. Since the outbreak of COVID-19, even though some telepractice was conducted, approximately half of them still ran sessions that were mostly face-to-face. Where telepractice was delivered, Zoom was the most often used video conferencing application, WhatsApp was the most often used messaging application, and laptops were the most often used equipment. Top benefits of the use of telepractice reported were convenience or ease from traveling for both clients and STs, ability to provide additional training to caregivers, clients increased accessibility to therapy, and increased involvement of caregivers. The top challenges included a lack of hands-on approach or tactile feedback, technical issues for clients or caregivers, and lack of experience from clients or caregivers in using technology. Half of the participants cited a somewhat positive overall experience using telepractice, while about 1/3 of them reported personally mostly preferring a face-to-face mode of service delivery. When being further inquired about why they preferred in the way they reported, Participants with a preference towards face-to-face mode commented some key reasons, such as better rapport or engagement with clients or caregivers, better behavior management, and increased quality of training or hands-on demonstration. Participants with a preference towards telepractice indicated the top reason as it being more convenient. In addition, 46 participants claimed to be quite confident in using telepractice for service delivery. 22 participants also indicated a need for training in clinical skills or services delivery over telepractice. A majority of participants were generally open to continue using telepractice in their service delivery even after COVID-19 is over. When asked about the participants' thoughts on the ideal proportion of face-to-face versus telepractice service provision 5 years from now, 60 chose a higher proportion towards face-to-face mode, 32 chose an equal proportion of the two modes of service provision, and 18 chose a higher proportion towards telepractice. Overall, STs in Singapore held a generally positive attitude towards telepractice, even though most would still prefer to use a more face-to-face mode of service delivery. There is a general recognition that both modes have their pros and cons. However, the benefits of telepractice, like convenience, flexible schedule, reduced traveling time for clients, tended to be outweighed by the benefits of face-to-face therapy, like better rapport, engagement with clients or caregivers, better behavior management, increased quality of training, or hands-on demonstration. STs in Singapore were also mostly confident in their use of telepractice in their service delivery, although some training in clinical skills and service delivery competencies specific to telepractice use was welcomed. Given the newness of telepractice adoption within Singapore, these findings contribute to an area of knowledge that has been scarcely explored in the current literature. Looking to the future, STs in Singapore were mostly open and willing to continue using telepractice even after COVID-19 is over. And a mixed mode of service delivery is still the proportion of choice, the highest proportion of choice, which also tended towards face-to-face therapy. This is not unexpected, considering that the suitability of clients for telepractice can vary across individuals. These findings, however, tread relatively new ground by examining the perspectives of STs in the Singapore context. It is possible that results may vary across clinical areas or age groups of clients due to the divergent nature of work. However, as the scope of this research focused on broad threads within the speech therapy landscape in Singapore, an in-depth analysis of responses based on these factors was not feasible. Future work may explore ST's experiences, attitudes, and preferences towards telepractice in greater detail based on clinical areas or age groups of clients. Perspectives towards telepractice from the point of view of clients and caregivers, as well as the effectiveness of different modes of speech therapy on clinical outcomes, may warrant further investigation as well. It must also be noted, though, that the population of patients receiving speech therapy in 2020 during the pandemic may be only a subset of those in the usual times, perhaps even a group with less health risk of the virus and who may likely have made greater improvement anyway. Further consideration include potential changes in service accessibility due to switches to teletherapy, particularly for the socially deprived, usually those with limited access to technology, and those who normally have difficulty attending appointments because of caring responsibilities or travel restrictions, etc. Thank you very much for listening, and we would like to make some acknowledgement here, like acknowledge Dr. Tom Kovacs in providing advice to our initial survey development, and the support from SALT, the speech therapy programs in the National University of Singapore and the Singapore Institute of Technology and the special education schools in Singapore. We are also grateful for the funding support from NTU Eureka program for this research study. Thank you very much. I look forward to your questions.